Hello guys, this is the first episode of Bua Thai Massage, episode 1. We are going to be going over these massage techniques. This is a Japanese technique, but it's also used in Thai massage. They're similar. You place your knees on the ischial tuberosities of the posterior back, well, technically near the crease of the gluteus maximus and hamstrings. And then you shift left to right while lifting up the upper torso using the weight of your pelvis, like towards the pelvis as an axis to rotate and rock side to side, but first from the bottom to the top. Then you can elephant walk from the wrists all the way to the shoulders. There's a pressure point near the shoulder where it creases towards the torso, the upper extremities. Then you massage the trapezius. From the trapezius, it's a big muscle, flaps over the latissimus dorsi, the very center of your torso near the abdominal wall, as she's doing right now. And then towards the sacrum. Completely safe, since pressure is not sharp. You're not putting 100% of your pressure. You're lightly, gradually applying pressure. Then you're rotating on said ischial tuberosities by placing your fists at the level of the hip from side to side, rocking back and forth. Notice how she makes fists so that she can carry her weight as she rotates on the ischial tuberosities. Coming down to the hamstrings, we have 3 hamstrings. BTM, right? And then we're coming down to the calves, the gastrocnemius, as well as the second layer, the soleus. In China, they call this the second heart of the human body, as it pumps blood rapidly to the heart through the vena cava. And you make an ice, and that's it. That's the first technique done. Thank you, instructor. Part 2 coming up next. Beginning this technique, we first cross the legs, compress them towards the sacrum. From this point, we pull them back. We switch by interlocking the ankles and then push them towards the sacrum yet again. Pull back. With both knees on the ground, we push out the right knee with our right knee so we can interlock the left anterior ankle with the posterior knee of the left leg. Then we, in a kneeling position, we position ourselves in a kneeling position to caress the left anterior ankle of the client suspended in the air and compressing the lower posterior gastrocnemius of the right leg that is folded perpendicularly up from the gastrocnemius to the hamstrings, and then from the hamstrings to the sacrum. Compressions are still done from the sacrum to the lower rib if you are short. If you're a taller individual, you can extend yourself and compress along the shoulder blades, or the scapula if you will, and near the trapezius, gallbladder 21. Make compressions there if you're taller, but if you're shorter, just near the lower rib cage. So again, there are limits based on height. Repeat this process from the lower rib cage or the trapezius if you're taller, down to the lower ankle. Making her way down to the lower ankle, she compresses the hamstrings on the posterior thigh of her right leg. As she makes her way to the plantar side of the foot, she cusps the sole of the foot with her left hand and rocks the lower leg as she compresses it with her right hand, like a seesaw. 1, 2, in a rocking motion, as you can tell. An elephant walk, if you will. All the way up to the sacrum, because you're rocking the lower leg as well as compressing the leg from the ankle to the glutes towards the sacrum. Alright, from that point, the torso is also compressed slightly up to the lower rib cage. Again, if you're bigger, and then you have the advantage of compressing the scapula as well. In this case, only the lower rib cage can be reached. But again, note the seesaw motion of the lower leg. The right hand is compressing as the rocking is continued with a cusped hand on the sole of the foot with the left hand of the professor. Professor is now adjusting herself so she can roll her forearm. We need to adjust our position. We're going to adjust our position by placing our elbow, the flat side of our elbow, and roll it along the plantar side of the foot of the client's left foot that is supported by our thigh. After retreating from the kneeling position, we're compressing the left leg interlocked with the right towards the sacrum, gradually, of course. In this position, compressions are made using the left palm from the ankle joint to the knee joint, alongside the tibialis anterior, which is the muscle proximate to the tibia. Cusping the lower left knee with the left hand while placing the right hand on the anterior angle of the left foot of the student. It is slightly elevated upwards from the ground. Never turn the torso. That can cause an injury to the student. Like so. As you can see, now we position ourselves from a sideline position so we can elevate the leg laterally towards the abdomen while placing our right foot on the sacrum, which can support our weight, but do not fully put your weight on the hamstrings like so. As we compress from the sacrum to the hamstrings, it is done gradually without putting the full weight of our body. Like so, in a rocking motion, back and forth, towards the abdomen, as you can see. Let it down, and you do the opposite side. You push the left leg, and you repeat the process yet again.
After you finish, make sure you make nice.
And then make nice.
All right, let's practice.
Thank you, Professor.